She immediately started opening up about her experience, and long story short, she, at a very young age, went to go see a physician about her depression that she was suffering from and got put on the wrong dosage of antidepressants. It was a much too strong dosage for where she was at that point, and it put her into a much more serious condition of depression than what she was even experiencing before. Welcome to Let's Talk Mental Health, where we bring awareness to the causes and solutions of mental health conditions. I'm here with Dr. Neil Nedley. From your perspective, where exactly do medications fit in this grand scheme of mental disorders? And I'm sure there are some that medications are very successful with and some that aren't. What would be some examples of that?
Well, studies show that at best, 2/3 of people will improve somewhat on antidepressants within a few months of taking these medicines. Only 20% are actually no longer qualifying as having depression and anxiety. So they can be helpful, but we normally utilize these medicines. Of course, as a physician, I can prescribe them as well, and often I do. But these medicines have to be utilized as a short-term stopgap measure until we find the underlying problems and reverse those problems. And in our experience, 90% of people with depression and anxiety, once we take care of those underlying problems, they're going to be able to live depression-free, anxiety-free, and medication-free. But there are 10% that, because of certain scars on their brain and those type of things, will be able to live depression-free and anxiety-free with taking care of the underlying causes, but they're also going to need medication on board. So only 10% of people with depression and anxiety really need the medications long-term. The rest of them, if we take care of the underlying conditions, it's just a short-term effect of a few months. Stop it before a lot of those side effects and the depletion of the neurons occur, and then you'll be better off and you won't have as many issues than if you're on them for years.
Recently, I was conversing with an acquaintance of mine about my job, and I was basically saying that I worked for a mental health company, and they instantly became very interested in that and wanted to know what exactly I did. And she immediately started opening up about her experience, and long story short, she, at a very young age, went to go see a physician about her depression that she was suffering from and got put on the wrong dosage of antidepressants. It was a much too strong dosage for where she was at that point, and it put her into a much more serious condition of depression than what she was even experiencing before. And it just kind of shocked me to hear that someone who's a professional and that's their livelihood would put a person in a situation like this. And obviously it wasn't intentional, and I guess I was just shocked really that these situations happen, and I'm sure this isn't an isolated case, and I was wondering what you've seen in regards to treating depression from a drug standpoint or a pharmaceutical standpoint.
Well, pharmaceuticals are the #1 treatment for depression today. It doesn't mean they're the #1 best treatment, but if you go to a doctor and you have symptoms of depression, expect to be put on a medication, because that's the toolbox that they're aware of, and that's the tool that they can provide that you can't get from non-physicians. And so these drugs are utilized and passed out like candy today in every pharmacy. It's the #1 class of drugs sold now in America.
Which is that antidepressants?
Antidepressants,
wow.
Yeah. And so, but these things are actually altering what's happening in our synapse and where neurotransmission occurs. They're actually not expanding our ability to make neurotransmitters, nor are they helping us to have more receptors to bind onto the neurotransmitter. What they're doing is plugging the vacuum cleaners that actually vacuum the synapse up after the synaptic activity is supposed to occur. And by plugging up those vacuum cleaners, there's more of that, maybe serotonin, if it's a serotonin, selective serotonin reuptake inhibitor, there's more of it there. So if there's lack of serotonin, we might get more of a synaptic transmission. But eventually they're going to deplete the very neuron of the substance that we're trying to treat. And so that's why people end up becoming what we call psychiatric cripples, because then they relapse even when they're on medicine. They need more doses, they need more medicines over time. But really the underlying causes of the condition are not being addressed. And so, and if you get on too high a dose or you don't need a selective serotonin reuptake inhibitor, not everyone with depression has a serotonin problem. And so if we block the serotonin reuptake, we might have an excess of serotonin. And if that's not our problem, we could get worse. We could get headaches, we could get confusion, we could get nausea, we could get diarrhea. There's all sorts of symptoms that can come about. It can produce a flat affect of I don't care attitude anymore. And so these are things that are the untoward side effects of the pharmaceutical industry, and I assume she was getting some of those side effects, which can even get you worse. One of the things that we caution, in fact, every doctor is cautioned on it by the PDR, that these drugs actually worsen impulsivity before they improve depression. Well, suicide is often an impulsive act, so if you have someone who's thinking of suicide and now you've made them more impulsive before they improve depression, that can actually cause or be one of the precipitating factors of causing suicide. So many people that commit suicide are actually just put on antidepressants. Within that first month is when it tends to occur. So this is why prescribing medicines are not for the faint of heart. You need to really know what you're doing. You need to know how to monitor this. And what we would recommend for the patient is your doctor actually looking for the causes in you, and are they addressing those causes? Are they using other tools besides just medicine?
As far as going to get off of these medications, is there a process that you recommend? I'm sure you don't want people just at home, saying, hey, I guess I don't need these anymore. Let me just throw them away, flush them down the toilet. I'm sure that's not a recommendation that you would give.
Right.
But is there a process that you use or that you have your patients go through that helps them, find the drugs that they're not needing and get off of those?
Yeah, absolutely. There is a process, and we have this process based on if we've taken care of the underlying causes. And then we get their depression scores down to where they no longer qualify as having depression. And if we've taken care of the underlying causes and they no longer have depression, they're able to start the wean. And that depends on which medication it is and how we wean it. Every medicine is weaned off a little differently. There's some that are very easy to get off of, like Prozac or Wellbutrin. And Wellbutrin we can stop abruptly when it's time, and there isn't really the withdrawal symptoms. Prozac has such a long half-life, it weans itself off. You stop it and it takes 30 days to get out of your system, so it's kind of an easier one to get off of. Now, they might have withdrawal at 30 days, but they're not going to have withdrawal tomorrow necessarily when they stop it, particularly if we've taken care of the underlying issues. But the other ones will require more of a weaning schedule. And normally that weaning schedule, they're often within a matter of 3 weeks, maybe 4, as we slowly taper and have them evaluate their mental health status. They take some objective self-tests every week while they're doing this to make sure they're still able to wean off of this. And actually, once they're off the medicine, they'll actually talk about feeling far better than they did with the medicine, because now they actually don't need it because the underlying problems have been solved. Now, it should be stated that a lot of doctors know how to put people on these medicines, but not a lot of them know how to take you off. It's going to be more of a psychiatrist or someone who's very familiar with the use of these drugs. People like myself who are dedicated my life to knowing the effects of these medicines. Those are the ones that are going to be the best as far as being able to put you on a weaning schedule to successfully get you off of the medicines.
Well, thank you for your time. This is great content and very good things to know when dealing with depression or anxiety or any of these mental disorders, and having to deal with the medications that come with it. So thank you for your time, Dr. Nedley.
You're very welcome.
This is Let's Talk Mental Health. I'm your host, Nathan Nedley, and as always, stay healthy, live happy.